Hi, this is Ginny Mason. Today we're going to look at the evidence-based practice. Our exemplar is the PICO model. And again, this will be reviewed in class and you can ask any questions that you have. Hopefully this will allow us more hands-on participation. The concept definition for this is the legal system might define evidence as a way of establishing innocence or guilt. In the sciences, it might involve steps to determine benefit or harm of an intervention performed on behalf of the patient. In evidence-based nursing, the concept is defined as an ongoing process in which evidence, nursing theory, the nurse's expertise, and patient involvement are used to critically evaluate the care of the patient. Evidence-based practice model looks like this. There's the best research evidence you can find. Add to it clinical expertise, and also add the patient's values and preferences. The purpose of evidence-based practice is to use the best evidence available to make patient care decisions. Most of the best evidence stems from research. Evidence-based practice goes beyond research use and includes clinical expertise as well as patient preference and values. So the use of evidence-based practice takes into consideration that sometimes the best evidence is that of opinion leaders and experts, even though no definitive knowledge from research results exists. Whereas research is about developing new knowledge, evidence-based practice involves innovation in terms of finding and translating the best evidence into clinical practice. The scope of practice. It's a concept. The scope of the term evidence can be visualized as a range from the discovery and generation of evidence on one end of the spectrum to the delivery of care at the bedside on the other end. There are steps in finding solutions to practice problems. One is to develop an answerable question. Two is to search the literature to collect evidence to answer the question. Three is to evaluate the evidence that you found. 4 is to apply the evidence that you found and incorporate the patient's preferences into that. And 5 would be to evaluate the evidence by evaluating the outcome. PICO model is an exemplar of one way of doing this. The P stands for the patient or the problem. The I stands for intervention, which is the new thing you want to introduce. C is the comparison, the old or current way. O is the outcome. T is the time frame, although this is not always included. So an example, we often start with a vague question such as, how effective is CPR really? But what do we mean by CPR? And how do we define effective? PICO is a technique to help us or force us to answer these questions. So for our patient community problem, our question above doesn't address a specific problem other than the assumption of a person who's not breathing. So you ask yourself, why am I interested in this? Is it a specific age group? Is it a specific population? Is it individuals with specific health problems? Or is it anyone who happens to be not breathing in a community setting? The intervention, our question doesn't really have stated interventions, but we might have one in mind, such as hands-only CPR. The comparison is the current method of CPR that we're using now, which involves breathing as well as hands-on. The reason we might want to look at this is because not everyone is going to do mouth-to-mouth breathing because they might be harmed. The outcome is, what do we mean by effective CPR? Did the patient survive the CPR? Mortality is the one option with the benefit that's easily measured. And then the time frame would be the time frame that we collect data for. Our PICO statement might look like this. Our patient or problem is community dwelling adults who happen not to be breathing. Intervention would be hands-only CPR, which is compared against hands plus breathing CPR. And then the outcome will be mortality or survivability. And this CPR is fairly easy. You use 2 hands, you push hard and fast, and you call 911. So what does the PICO stand for? PICO is the problem, the intervention, the comparison, the outcome, and we've left out the time frame. From our PICO, we can write up a clearer and more specific question, such as, in community dwelling adults who happen to not be breathing, how effective is hands-only CPR versus hands plus breathing CPR at preventing mortality? Please complete the online activity e-learning. Thank you.